Hello, friends. This is Dr. Chaudhary Anayatullah. I'm again here with you today to talk about coronavirus and its relationship with the climate. Uh, there has been a very good study which has conducted by some scientists in Germany and Greece, and it is basically a forecasting model for about the climatic influences on the worldwide spread of coronavirus 2. And in this study, what they have done is that they have taken about 16 weather parameters like maximum and minimum temperature, diurnal temperature, annual temperature, monthly temperature, and so on and so forth. And they have tried to predict the spread of coronavirus all over the world. Uh, the first observation that their model has shown is that the tropical parts of the world will be the least affected, and then there will be a shift towards the tropical to temperate and Mediterranean bioclimatic regions. So these temperate and Mediterranean bioclimatic regions will be affected the most. Now, they have produced a number of maps, which I am not going over here, but the key finding of their simulation model is that there will be an increased probability of infections in Europe, followed by an expansion covering areas of the Middle East and Northern Africa, as well as eastern coastal areas of North America, southeastern coastal areas of Latin America, and two areas of southern Australia, which is way down close to the New Zealand. Uh, and you see, and but when we look at the actual number of infected people and the mortality rate in various countries, then we see that it is exactly the same way that the pattern is going on. So right now, the infection is highest in Europe and North America. But basically, the purpose of this study is that it may be of significance value to incorporate the climatic influences in the design and implementation of public health policies. So we can, we can be alerted in advance that these areas are going to be infected. There is another study which is conducted in China by the Luanzhou University, and it is on effect of temperature variation and humidity on the mortality of coronavirus. This study is based on the data from 20th January to 29th February, and during this period in Wuhan, total deaths were which happened was 2,229. And what they have found is that there is a positive association of coronavirus mortality with the diurnal temperature. So, which means that the increased variation between the maximum and minimum temperature will lead to more higher death rate in a given area. It is, I think, basically due to the fact that the abrupt temperature changes lead to burden on cardiac and respiratory system, causing cardio-pulmonary events, and high DTR level may be a source of environmental stress on the. However, this study also informed that there is a negative association for relative humidity, which means that when the humidity will rise, the incidence will go down. Uh, Now, this is a very important slide that, important paper that I have came through. It is on the effect of temperature and relative humidity on the viability of the SARS coronavirus. So this is SARS-1 coronavirus 1, and this was published in 2011. And, the main exactly the same story. The main route of transmission of SARS coronavirus infection is presumed to be because of the respiratory droplets, which is like the present corona outbreak. The dried virus on smooth surfaces retained its viability for over 5 days at temperatures between 22 to 25 degrees centigrade and relative humidity of 40 to 50%. That is a typical air conditioning environment. So in this environment, the virus survived at least 5 days. Uh, the better stability of SARS coronavirus at low temperature and low humidity environment may facilitate its transmission in countries and subtropical areas such as Hong Kong. This is what this study concluded that it is going to happen in more in Hong Kong and during the spring and also in the air conditioned environments. And we observed that more or less the same results were happening during the SARS outbreak. Uh, this study also found that the virus viability was rapidly lost at higher temperatures and higher relative humidity. For example, if at a temperature of 38 degrees centigrade and relative humidity of more than 95%, the viability of the virus was greatly lost. Now, this phenomena explains that why some Asian countries in tropical areas such as Malaysia, Indonesia, Thailand, with high temperatures and high relative humidity environment, did not have any major of SARS virus in 2010 and 11. Uh, Now, this is I will show you some of the numbers of coronavirus infection in different countries during different times, and we can see that these are the this column indicate the countries. These are the number of infected cases 20 on 1st of March, and this is on number of infected cases on 27th of March. These are the cities, and this is their temperatures on 29th of March. Now we can see that, and this data is based on WHO situation reports. Uh, on 1st March, there were 62 cases, and we jumped to 68,334 on 27th of March. And the temperature in New York at that time was 8 degrees centigrade. In UK, 23 cases on 1st of March and 11,000 plus on 27th of March, and the temperature in London was 8. In Italy, the infection rate in 1st of March was 1,689, which jumped to 80,539 on 27th of September, and in Rome, the temperature was 17. So we can see in these countries that the temperature is very low, and also the infection is spreading at a very high speed. In Indonesia, the comparable data for some of the countries in the tropics, I share in Indonesia. On 1st March, there were two patients, and which jumped to 893. And in Jakarta, the temperature was 26. In Singapore, on 1st of March, there were 102 cases on 1st March and 683 on 27th March, and the temperature was 28. In Thailand, 42, which jumped to 1136, and temperature was 29. In Malaysia, it was 24, and on 27th, this was 2031, and in temperature in KL was 28. So we can see that in all these countries, Indonesia, Singapore, Thailand, and Malaysia, the temperature was quite high, which ranged from 26 to 29 degrees centigrade. And also the speed of transmission of the virus was very, very low compared with the countries in Europe and as well as in the USA. So this really supports the findings of the previous study which I presented supports that with the increase in temperature, the transmission rate of the virus will go down. Since I am from Pakistan, so some data about Pakistan, I would say that in infected persons on 1st March were 4, which jumped to 1,526 on 29th of March. But I'm not sure about this data because we had a limited testing capacity, and that might have made some differences. Uh, However, when we look at the temperature, In Islamabad, the capital, yesterday the temperature was 18, and Lahore it was 22, and Karachi it was 27. And forecast for April is 31, and in May it is the forecast is 36. So what I'm concluding from this data and from the previous studies which I had presented, that as the temperature will go up in Pakistan and as well as in Bangladesh, India, and other neighboring countries, the transmission rate of the virus will go down. However, we need to follow the other measures like testing and isolation and quarantining and social distancing. All those are very important to keep the viral load as minimum as possible. Well, thank you very much. I hope that this information you find it very useful. And here are my contact details. I will be available for any question at any time. Thank you very much, and have a good day.